Pull the light.
Yeah, it's this thing. Oh, okay. Well, we're live even though it says I shouldn't be. So with that, good morning, everybody. Welcome to a regular meeting of Madera County Board of Supervisors. Today is Tuesday, March 16th, 2021, and I'll ask for a roll call.
Supervisor Frazier.
Here.
Supervisor Gonzalez.
Here.
Supervisor Rogers.
Here.
Supervisor Wheeler.
Here.
Chairman Poitras.
Yes, thank you. Are there any additions to the agenda? No. Yes.
Can't get my mic to.
Okay.
Sounds like it's hot, but it says that it's not. Okay, that's interesting.
Yeah.
So I do have two additions to the open session of the agenda. They're both subsequent need items that came up, one on Friday midday and one actually yesterday. I'd like to read them to you separately so you can choose separately whether you wish to put these on the agenda. The first is a letter that we'd like to file in the Federal Register. It's in opposition to the Federal Office of Management and Budget proposed change to the Metropolitan Statistical Area threshold. That has to do with the fact that they want to move that threshold from a city of 50,000 up to an area of 50,000 up to an area of 100,000. And that would have a negative impact on the county in terms of what census data is gathered every 10 years. And of course, then it would have a negative financial effect on both the city and on the county.
Okay.
I move to take up this item, finding that it arose after the posting of the agenda.
I'll second that.
We have a motion and a second. Can we have a roll call vote?
Supervisor Frazier.
Yes.
Supervisor Gonzalez.
Yes.
Supervisor Rogers.
Yes.
Supervisor Wheeler.
Yes.
Chairman Poitras.
Yes.
Vote passes 5-0.
Thank you.
Chairman, the second item came up actually yesterday. It is a request from Cal Travel, which is the trade association that supports all of the convention and other activities within the state of California. It's a request to have the chairman sign on to a letter that they are forwarding to the governor requesting some specific guidelines related to what they can and can't do as we move forward through COVID. If you're familiar with the travel industry, many of these places are, and many of the firms that have to schedule these items for their associations and other groups, they're already scheduling into 2022. So right now, it appears that California remains closed. Therefore, we're losing in California a significant amount of business that particularly has a negative impact on our districts that have the hotels, and in this case, that would be predominantly District 5. So I will share with you the letter that they are using as a draft, and then it's going to be similar to probably what you've seen with other associations you may be associated with, that they do one letter and then they do pages upon pages of signatures attached, so they can send it as one unit to the governor. So this would be a letter supporting Cal Travel's request from the governor to provide through CDPH industry guidance for business meetings, conferences, and events.
Very good. Do we have a motion for action?
Move to approve.
The addition to the agenda. Okay,
Good addition to the agenda
there you go.
because it arose after the posting of our agenda.
Second.
We have a motion and a second. Can we have a roll call vote?
Supervisor Wheeler.
Yes.
Supervisor Frazier.
Yes.
Supervisor Gonzalez.
Yes.
Supervisor Rogers.
Yes.
Chairman Poitras.
Yes.
Vote passes 5-0.
And Chairman, we will handle these under your agenda, item 8, supervisor and staff reports when it comes time for that. Thank you.
Very good. Thank you. Moving on to closed session. Council, can you read them, the closed session items into the record?
Yes. Chairman, one item 2B, related to the decision whether to initiate litigation. I'd ask if the board allow me not to read that into closed session. The item does not need to be discussed. It will come at a later date. And so the only item for your closed session is under Government Code Section 54957.6, conference with your labor negotiator. Your Director of Human Resources is your agency designated representative, and Susan Carter, and the employee organization is all units.
Okay,
Do we need a motion to pull that?
No,
okay, very good. And so you read that. Are there any comments from the public regarding the closed session item? Seeing none, we shall now move into closed session. Thank you.
I just want. No.
He wants to hear the extra thing you have to say.
I'm going to turn them all. Did you turn them off? So they're on. Testing. Testing. Oh.
Good morning, everybody. I'd like to welcome you to a regular meeting of the Madera County Board of Supervisors. Today is Tuesday, March 16th, 2021, St. Patrick's Eve. I will ask now for a roll call. Make sure everybody's on board.
Supervisor Frazier,
Here.
Supervisor Gonzalez.
Here.
Supervisor Rogers,
Here.
Supervisor Wheeler,
Here?
Chairman Poitras.
Yes, thank you. I'll ask our council if there were any reportable items at a closed session.
Chairman, there are no reportable action from your closed session.
Okay, very good. Thank you. We'll move now to open and close the meeting in memory of individuals. And Supervisor Wheeler, I believe you have somebody you'd like to remember.
Yes, I do. Very, very special person, Merritt Gilbert. He was even on TV last night, which really surprised me. But when I first started Sierra High School in 1958, he was a JV football coach, and he was our coach. And first thing he did when I went out for quarterback, he called me Big Tom, and I thought that was pretty cool. But he made me the quarterback, and he said, "What position you play?" And I said, "Heck, I don't know." So they had a tire swinging on the goalpost, and he had everybody throw passes, see if they could go through the tire swinging. And I put most of them through it. So he said, "Well, you're our quarterback." That year we won the league champion, so that was pretty cool. So, and most of the starting 11 were from North Fork. We were pretty tough Okies and Indians up there in those days. So, but then he went on and he also coached basketball. And on TV last night, I knew he'd won a lot of games, but he was 300 and something wins and only 100 very small, low hundreds in losses. And in 60 to 62, he was undefeated all 3 years. And I graduated in 61. But when I went out for my senior year basketball, they had too many good guys, so I didn't get to play. So I was on the gymnastics team. So, but then he went on, and after that he got in administration. But when I got on the school board at Sierra High School, we actually appointed him as our superintendent of Sierra High School. And then from there he retired, and from Sierra, and they made him the CIF commissioner, head of all the high schools, Benji, of all the high schools in the valley, and he did a heck of a job there. And one thing that after I got off the Sierra High School board, he gave the 5 of us was on it that year. Well, I mean there was 7 of us, I guess, but 2 or 3 of us went off. He gave us metal, aluminum, lifetime passes to all CIF high school games. And I'm very proud of that. And every time I show it at some game or something, to get in, they say, "Where'd you get that?" And it was an honor. He was a gentleman, my mentor. He was just one heck of a guy. 93 years old, so good man.
All right, very good. Thank you. Are there any other
Yeah.
people like to remember? Supervisor Frazier.
I have one that I don't know how I missed it in January, but I just went to Madeline's alterations this last week out in the ranchos. Just a wonderful lady out there, and her husband, Mr. Ohan. He passed away in January of leukemia, and I just wanted to open and close in his memory, and missed it back then, but he was just a very nice man. I don't know if you remember Ohan Shish Kebab that was downtown. It was back when I was in elementary school, but they made amazing food, and just sad for her and the family, and just wanted to open and close in his memory.
Very good. Well, thank you. We'll move now. There's no other people. Okay.
I just found out that she served the community well for many years. They're well-known figures, always attending the functions.
I didn't
of the
catch that
community.
name, Dave.
Rita Carnaja,
Oh, okay.
a well-known member of our Chowchilla community, and she will be missed. Thank you, Jay, I did not know.
Okay. Anybody else? Okay. We'll move now to the invocation and pledge of allegiance. We have Pastor James Kendall of Grace Community Church who's going to lead us in the invocation, and Sarah Anderson will lead us in the pledge of allegiance.
Let's pray. Father God, we come to you with grateful hearts, Lord, for all the good that you have provided for us in this life, Lord. We're thankful for our health and friends and family, Lord, and for all the good things that you provide. As always, Lord, we come to you with requests, Lord, asking that you would work, that you would give our supervisors wisdom, Father, as they lead our county, that you would give them guidance, Father, how you want them to lead, to help us as we hopefully get out of this COVID mess, Lord, and get back to some sort of normal, Lord. Give them wisdom and all that. We do pray for those that are hospitalized, for those that have been sick, that you would provide healing for them, Lord, that you would help them to recover. And we do praise you for the good things in life, Lord, the vaccines that you've helped create to provide immunity, Lord, to protect lives, and to help us to get out of this situation, Father. So in all things, we just ask that your name would be honored and glorified. And it's in the name of your Son, Jesus, we pray.
Pledge allegiance to the flag and states of the republic for God, indivisible.
Thank you. Let's move to public comment. And just as a reminder to everybody, the first 15 minutes of each meeting are set aside for members of the public to address the board on any matter under the jurisdiction of the board, but not appearing on the agenda. The board will not take action on any items presented under public comment. Speakers are limited to 3 minutes. Anyone addressing the board is asked to print their name clearly on the speaker sheet at the podium and state their name and county of residence for the record. Are there any members of the public wishing to provide public comment at this time? I don't see anybody rushing to the podium, so let's move on to the consent calendar. And I believe Supervisor Wheeler has items F, H, and I that he'd like to discuss further. And are there any other items that supervisors like to pull? Yes, Supervisor Rogers?
And for pulling, just to make a comment,
On which item?
I through L.
I through L. Okay.
And I just wanted to make a comment on S.
Okay. Yes. Okay, very good. So let's go with Supervisor Wheeler, item F.
Yeah, I just, I can't wait to get this done and stuff, but I just was wondering why, what happened on that name. I looked at it, I see they didn't print it in there right, or we didn't print it in there right. And what the objection was it, and we got that corrected, I see, but I didn't understand the bigness of the deal that they made a big deal out of that. How you doing, buddy?
Hi, Supervisors. Jorge Mendoza, Capital Projects Manager. So Smith Emery San Francisco basically used a short name of their legal name as listed on the State of California Secretary of State. One of the bidders took objection to that and figured that it was submitted a bid protest. We reached out to legal counsel to take their opinion on this matter. They did the research and found basically the legal name for Smith Emery of San Francisco Incorporated, and that's who that's what we're recommending to execute a contract with. Smith Emery of San Francisco has basically 2 labs here locally in Hanford, California, as well as coverage in San Francisco and Los Angeles area.
Okay, I figured that's what it was, but I thought the public should know a better explanation of it. I didn't want to think that we, picked companies that wasn't real or something.
No.
Okay. And then on
Item H.
on item, actually, I wanted to find them here. It's from I to L is what, H I didn't have. I just wanted I to L,
Okay.
the grand jury reports. And I sometimes get so disappointed in grand jury and I'm not going to say something stupid this time like I did before a few times, but and like an item, see, J, one of them, the one that has it on there about getting, trying to change your property into, rezoning or whatever you want to do, what they're trying to do, the grand jury's trying to take away constitutional rights that they have no right to do. If somebody wants to apply you have to wait a year. If they want to do it every year on a piece of property, that's their right to do. That's America. And them to say that we've stopped that, it don't make sense. I guess they don't think they don't use the Constitution. Maybe, I don't know. But they want to do that. They have that right to do that. And then want us to interfere with the city of Madera or any city for that matter, that don't happen. And one thing I'm really happy about all the responses that we did. I thought they were really professional and a lot more better than what I would answer them. But to try to interfere with what the city does with whatever it is, and obviously they don't know the city owns the airport. We have nothing to do with the airport. That's just, it's just weird. We if we wanted to talk about it, we could go to the hearings they have on anything like that, just like they can come to ours, which I think all of us have done that, both sides. If there was something that concerns us, we go to their hearings just like anybody else. They can't make us be a part of something that we can be a part of. And what really bugs me is to say that any of us are breaking the Brown Act. I think they better read and see what the Brown Act says. It's, they obviously don't know, and they haven't paid no attention to us. It comes enough to our board members' meetings to know that, especially our lawyers, they make sure we do. That's why we have training on it every year or two to make sure that we all do it right. I carry my Brown Act book with me in a lot of places I go to, so that they're, that we abide by it. So I don't know. It just bothers me. I mean, did they interview any of us about the Brown Act? No. They do it. They just take this stuff on their own. And they did this 3 or 4 times now that I've been on this board, and I don't know. They disappoint me. That's all I'm going to say. Thank you. That's all I have to say on it.
Okay, Supervisor Rogers.
Yeah, when I came into office, I evaluated something really quickly that I knew would happen, and that is that I would lose my privacy, my peace, and in some cases, my prosperity. And I want to thank my fellow supervisors, as well as all of those elected officials who serve based on the loss of those 3 things that are very precious to us. But we do because we want to give back to our community. We want to help our families and give a better future to the community and our families that live in those communities. We also live by the laws that we create. We also live under those circumstances. So in that regard, when I want to respond to items I through L, I say this to the grand jury. If the grand jury had been as clever about seeking fact as they were with their quippy titles, they would have come to very different conclusions and actually served the public like most of the elected officials do. Thank you.
Thank you, Supervisor. And Supervisor Frazier, item S.
I did notice that those titles were a little different than they have been in years past. They were very leading. Quippy, I think, is a good word for it. On S, I just wanted to thank staff again for getting this moving forward. This took a lot of work to even get to this point. We had quite quite a few bidders, which is always good for the public when people see a lot of people that that competition drives prices down. You may see this as a high number, but with those many, we were able to get the best deal. And I just staff just can't thank them enough for all the hard work that went into getting to this point. And the people, on behalf of the people of MD10A and the ranchos, I just want to thank staff.
Thank you, Supervisor. Matt Traber, Chief of Development Services. And to your point, yes, we did receive 8 bids. The low bid was a little over $400,000 under our cost estimate that was done. So thank you, Supervisor, and the whole board for the support on this. And a special thanks to Ray, Craig, and Jared up in Public Works to make this happen and drive that bus, as well as our partners at DDW and DFA. Pete Stamas, Matt Freeze, and Adam Forbes as well. So thank you. Very good. Thank you. Are there any other items the supervisor would like to discuss? Are there any members of the public who would like to discuss a consent calendar item? If not, I'll bring it back to the
Move to approve the agenda.
Okay,
We have
a
consent
motion.
calendar.
All right, the
I'll
consent.
second it so that we don't have to get into. Yeah, you're.
There you go. Perfect. All right, we have a 5 and 1.
Let me also backtrack and say I thought staff's response to the grand jury report was absolutely spot on and excellent. Thank you.
Yeah, they did a good job on that.
Yeah, spot on.
All right, roll call vote.
Supervisor Wheeler,
Yes.
Supervisor Frazier,
Yes.
Supervisor Gonzalez,
Yes.
Supervisor Rogers.
Yes.
Chairman Poitras.
Yes.
Vote passes 5-0.
Thank you. Item 6A, this is Social Services Department, and we have the opportunity to, we've got a proclamation recognizing the Professional Social Worker Appreciation Month. And let's see, Deborah is here. She's trying to fight her way through the crowd.
Check.
Yeah, 3 feet apart. Yeah, that's right.
Good morning, Board. My name is Steve Duckworth. I'm Deputy Director of Department of Social Services. It's my good pleasure to represent the department in joining with you all to honor our 82 social workers and present this proclamation to them here today. This past year was a very tough year, but the COVID pandemic, the Creek Fire, nothing deterred our social workers from continuing their mission to serve the families and children and adults in Madera County. Their mission in the community was, following COVID protocols, was difficult, but they still maintained their service levels as they were prior to the COVID pandemic, and they continue that today. So that you'll see them in the field, investigating reports of abuse and neglect, serving families, trying to reunite families, serving elderly and dependent adults in the same manner they did prior. So we're here in this very tough year to honor them. And we brought with us 6 of our staff to introduce to you all today, and a couple of them are going to share a few words about their work and their passion for their work in Madera County. It's my good pleasure to introduce Geraldo Naranjo. He's been with the department for 16 years. He's worked his way up the chain in the department. He's currently working to serve in the in-home supportive services program. And he brings a lot of passion to his work and a lot of expertise. I believe he's bilingual as well. Thank you. Um, Dante McDaniel joined us this past year in the midst of the COVID crisis. Prior to that, he was an intern with us. Young man is highly recommended for his work ethic. He's currently investigating reports of child abuse and neglect in our ER unit, which is a tough and demanding job. He recently received his Master's of Social Work, and he's well equipped to do the work and serve the families in Madera County. Side note, he's also a talented drummer.
Congratulations.
Kimberly Gonzalez has been with us for 4 years, just over 4 years. She's worked in child welfare services in many of their different programs, including ER, the Family Maintenance Unit, Resource Unit, and others. She has a real passion and a great advocate for the reunification process, helping families reunite after having come into the foster care system. Deneen Sa is brand new to us. She started a couple months ago, and she came to us out of the prison system as a counselor in the prison system. And so she's highly motivated, and she enjoys working and learning how to better serve the youth and families in child welfare services, foster care system. Maria Roscoe comes to us today to present a few words. I'll briefly introduce her. She's been with us for 4 years. She works currently in the in-home supportive services program. And she came to us after interning with us also. The internship program is a very valuable tool for us to introduce people to our work, because our work is difficult and we get a good feel for the fit, so where people fit and if they're going to have success in the field. So without further ado, I'll let her say a few words.
Hello.
Hey there.
I'm Maria Rosco. Don't judge me. I didn't memorize. But we wanted to thank you for social work. And
We're
so
having trouble hearing you.
better?
Yes.
Okay,
Yeah.
sorry. Okay, we wanted to thank you for having us here today. Of course, social work is our passion, and we are just very happy to be able to do what we love. I did intern with the county, and that's where I began to grow my little blossom. So I interned from adult protective services, and then I've just grown my way into in-home supportive services. Our program does help those aged, blind, and disabled to remain safely in their homes. Just as a community, we're able to provide resources and work within the community to make sure that we can be safe and strive for that. All together. That's all.
Here you go.
Thank you.
Thank you.
Okay, and our last social worker, Catalina Alcorn, has been with us for 5 years. She currently works in the Adult Protective Services Unit. She was recognized in 2019 as being an outstanding service volunteer for the Victim Services Program in Madera County. She was recognized officially. That was by CAP-MC, right, Catalina? Okay, so here's Catalina.
So on behalf of the Protective Services Division, I would like to thank the Board of Supervisors for this proclamation and for all of your continued support. As social workers and through these challenging times, we have witnessed firsthand tremendous suffering, loss, grief, loneliness. However, we have also seen more than ever witness the power of community, of compassion, of unity. We have seen the strength in our community with neighbors helping neighbors and essential workers determined to make a difference. As social workers, we believe in people, and it is our hope that we can all continue to work together. May we try to better understand each other because only then, in working together, we can make this community a better place to live. I am so thankful and so proud of all of my peers, both in child services and in adult services, who have remained very focused on the safety of and well-being of our children, of our elders, and our dependent adults or vulnerable adults. We all stand ready to assist our community in overcoming both current, present, and future challenges. Thank you so much.
Thank you.
I want to thank Maria and Catalina for sharing some words with us today, and I'll turn it over to the board for the reading of the proclamation.
Very good. Thank you. First of all, I'd just like to thank everybody for being here today. And it was Maria who said that, everybody was honored to be here today. Well, I'll have to tell you, I'm honored to have you here. And, and just knowing what the services you've always provided, but I mean, the service has been on steroids over the last year, because of everything everybody's dealt with, and it's over the top, and we're very proud of you, and thank you so much from the bottom of our hearts for your great efforts. And before I present this proclamation, I'd like to ask my colleagues if they have any comments.
I'd like to say that without your help, many people would go without help. And it is imperative that we help the most vulnerable members of our community to not only survive, but to thrive. And many of the services that you provide are just so important to those people. And we're all headed to a circumstance. We were all either in a circumstance where we were one of those people, or we were headed to a circumstance where we'll be one of those people someday. Everybody's getting older. Everybody reaches that point where they're no longer capable of taking care of themselves. And not everybody has somebody to help them. And it is so important that you're there, and what you do matters for people. And I think how we treat our most vulnerable members of society is a statement about our society. And certainly you prove that to be a positive thing for our community. Thank you.
Thank you so much. And Supervisor Gonzalez.
Yes, thank you. I just want to say thank you. And as a former employee of social services, I also know that it's not an 8 to 5 job. And so thank you for all your efforts, everything that you do. We wouldn't be where we're at today without you. So thank you.
Yeah.
Yes, Supervisor Frazier.
Those are the points that I wanted to make too, but this is not a job that you can just leave at the office. It sticks with you and is something that is so important to all of us and to the people. And I know that a lot of times not easy to you're in one of the hardest customer service positions on earth, right? It's sometimes the help that you're giving, people don't want it or don't know that they need it or are worried that they're just going to be in the system. And the fact that you all come in and day out, and all of your colleagues come in day out and help people is just a testament to your character. To choose that field, there's not a single one of you didn't know that it was going to be hard, right? This was not a position that you said, oh, I want to do this. It's not for a pension, it's to help people. And we just want you to know how much that's appreciated. And we know how hard that job is going into it, which is probably why, I wouldn't have been able to do it. And so I thank you and all the social workers that are out there that are doing this hard work because it's a passion and it's a genuine care for your fellow human beings. And I really, really appreciate it.
Thank you.
You know,
Supervisor
can I just
Wheeler?
say something?
Yes,
Chairman?
please. Uh-huh.
Just, what they do for the whole county is just unbelievable as far as I'm concerned, the whole department. And I just really appreciate what they've added up in the mountain communities the last probably 10 years. When I first got elected, 15 years ago, we didn't have very many services up here, but it's really, really changed. And thank all of you. Thank you for all your continuing education too, because that just brings a better department for all of us. So thank you, thank you, thank you.
This is going. So at this time, I'd like to ask all our friends from social services to gather in the front. I will present the proclamation, and we're going to get some pictures, and this will go on Madera County social media, which will make you instantly famous. Okay, next on the agenda, we have from District 5, we have the presentation, a proclamation naming March 2021 as American Red Cross Month. Supervisor Wheeler, I believe you're going to lead this presentation.
Yeah, I think Bobby's there to do it. He better be.
No, boy, I don't see him anywhere.
That's my luck. Gosh darn. Well, hey, well, you guys, oh, there he is. I was going to say, will somebody go look him up and fire him for me? That's right. I do it right.
Well, thank you, Chairman. Thank you, Supervisors. I appreciate your time this morning. As you indicated, I am here to present a proclamation to the American Red Cross. It is March, which is American Red Cross Month, and so very excited to be here before you today. We have a couple board members with us from American Red Cross of Central California. We have Aaron Johal here. I don't believe the other board members were able to join us, but we also have Lori Wilson, who is the Executive Director of American Red Cross for Central California, and Trina Poitras, who is the Disaster Program Manager for Madera County, as well as her faithful companion, Dante. So when we kind of stop and think about everything over the last 12 months and what we've been able to accomplish, not only as a county, as Department of Social Services, Public Health, and if Tracy's out there listening, and the tax collector's office, it's pretty remarkable what we've been able to overcome. And I think American Red Cross is no exception, how they were able to kind of reinvent the wheel as far as their temporary evacuation point goes and work out the kinks amidst one of the largest single fires in California history. Pretty remarkable. So a huge thanks to all of you, as well as the volunteers and all the other staff members that were not able to join us. With that, I would defer to the board if anything you guys wanted to add. Okay. You guys want to
Tom,
up front?
is
Just thank you so much for your service to our community, and what you organize makes a big difference. And I know I've worked with some of you in trying to get locations there in Chowchilla, and I think it was you. I can't see your face. That's okay. But thank you so much. And when you go through a disaster, your whole life is thrown in a dither, a tailspin, and you don't know what to do, and you don't know who to turn to. But in a history of the United States, the Red Cross has always been there, and always been on the spot when we needed help. And that's just amazing to have that kind of support. Thank you so much.
And they really, really take over when any disaster happens, whether it's a flood in Norfolk or a fire. I mean, I can't believe how quick they organized and ready to go. So between them and our sheriff department, man, I'll tell you what, they're the best in the West. So
yes,
thank all of you very, very much.
And hopefully this 2021 isn't as busy as 2020. So we'll, yeah.
A reprieve year.
Yeah.
Review your way.
Morning, Sheriff. Morning, Sheriff.
Item 6C, we have our opportunity to get an update on COVID-19 and our current vaccination administration status.
Good morning, Sarah Boss, Public Health Director. Happy to see you this morning, Mr. Chair and Board.
Thank you.
We are still in the purple tier. There's been some updates to the tier structure that we'll talk through, but our adjusted case rate is 11.3. That's pretty close to identical to last week. County positivity rate, 4.4%. Our health equity positivity rate is down from last week. That's a good sign, to 6.5%, down from 7.3%. The state updated the tier structure when the entire state reached 2 million doses administered in the Healthy Places Index zip codes that were identified in the lowest quartile. And that's a little bit different than how Healthy Places Index has been used for our positivity rate. And if it wasn't confusing enough, the state looked at Healthy Places Index for the state as a whole, which is something actually we were encouraging them to do. Prior to that, it was always used for accountability for counties at the county level. But we really felt it was important that the state actually use Healthy Places Index to be able to see, like, where are the areas in the state as a whole that need special attention with regards to resources and certainly with regards to vaccination. So we were happy by that step, but what they used was zip codes. And we actually have 9 zip codes in the county of Madera that were identified in that lowest quartile. And so we are receiving increased allocation as a result of that decision. So the tier structure, the way it was changed, is when that 2 million doses in those zip codes that were identified, they updated it to kind of raise the case rate that was required for moving from the purple to the red tier, also from red to orange. When we hit 4 million doses in those zip codes, those HPI zip codes, then the tier structure will be adjusted again. The idea is that we're going to be able to move more into being open as vaccination is rolled out, especially to those who have high risk for not having good health outcomes with regards to COVID. So at this point, our case rate needs to be 10 or less. It used to be 7, now it's 10 in order for us to have red tier data. But again, if our positivity rate in the health equity area goes to 4.9 or lower, we could also move that way. The bottom line is that if we increase our testing and we continue to vaccinate, we're going to be able to move forward. Our testing rate is up just a little bit. Still on the positive side, we're above the state median at 399 tests per 100,000. So we encourage people who are out regularly to continue to get tested even if they don't have symptoms, and especially those who are now participating in additional activities that have made available, like organized sports. And our lab is, increasing a bit access to testing. Our high volume lab is coming online this week, and we're entering into contracts with some school districts, some skilled nursing facilities and things for routine screening of individuals. In terms of vaccination, we now have over 39,000 doses that have been administered in Madera to 25,678 Madera County residents. That's up to 16% of residents that have at least gotten one shot. The eligibility has expanded, and a press release went out at 10 o'clock this morning notifying folks of this expanded eligibility. So the groups that were added includes those who are in congregate residential facilities, including our jail. So we're working today to get vaccine over to our jail, and as vaccine is available, we'll be rolling through vaccination with our WellPath partner there. Public transit workers, janitors, and those experiencing homelessness. We have started vaccinating our homeless population, working first with those who are staying at the Madera Rescue Mission, but we will be planning clinics in the future out at the locations where it's easy for homeless individuals to access. Our plan is to wait until we have a supply of Johnson & Johnson to be able to vaccinate that population. Also eligible are those who currently have a list of chronic conditions that have been identified, including cancer, chronic kidney disease, if they're immunocompromised, Down syndrome, sickle cell, heart conditions, diabetes type 2, and severe obesity. And then also anyone who has a physical or mental disability that's so severe that they're at high risk of an infection having a severe outcome, or the inability to receive ongoing care that's vital for best survival. So homebound individuals, those who struggle with severe mental illness, so individuals like that are now eligible. And it's going to take us a little bit of time to figure out how we're actually going to be able to disseminate vaccine to all of those groups. So many are eligible all at the same time. So we're going to work our way through that, of course, with the vaccine that is available to us. So the whole high-risk process that we had in place with people actually being able to submit something to Dr. Paul, that's not a process that we're doing anymore because now all of those individuals are eligible. So there are some updates to guidances. There continue to be updates that roll out. If there are any questions about guidance that people have, we encourage them to use the community feedback form. And I don't plan, unless you have specific questions about guidances, to provide all of those in the updates at the board, but certainly want to be responsive to your questions. That's all I have for you today.
Very good. Thank you, Supervisor Frazier.
I won't hold you to it, but what is like an estimate of when you think that we can get into the red if our numbers are continuing in the same way? Again, I'll even knock on wood as you say it, because I know that everything changes daily.
Everything changes,
Yeah.
yeah. So we're a little concerned about the plateau in the case rate. It's been very level. And that's what happened to us last time, where we stayed pretty level and then we kind of bounced around there. So I think that we are working on a reopening campaign this next week, engaging with the chiefs of your chiefs of staff and with our PIO team. When I left the office this morning, they were all brainstorming, like, how are we engaging partners to be able to get into the red tier and move forward. A lot of it comes down to testing. The more people we have testing, the better our chance. That's how a lot of other counties in the last time that we found ourselves in a situation that they were able to move forward is they just flooded the system with tests. And it's not a bad thing to test. So symptomatic, asymptomatic, we want people to test. And then, of course, staying on top of getting vaccine out as quickly as possible. I just can't make a prediction.
Yeah.
It's very tough. And one of the things that we're doing also is we're establishing contracts. We're in final negotiations with community-based organizations that are going to help us with things like door-to-door canvassing to do registration for vaccination and for testing in our HPI areas. Because if we can get the HPI areas down for positivity, but also target them for vaccination, then that's going to have the biggest impact on our positivity rate and case rate.
So yeah, I think that's a good way to rephrase that instead of an estimate. What is that we can do? And so as that campaign rolls out, let us know what we can do to get the word out and school districts and different things to get the word out to as many people as possible. And if we all get in it together and have like a day where everyone gets tested, that'd be great. So let us know what we can do to help.
Thank you.
Thank you. Supervisor Rogers.
One of our local farmers has done a great job in helping get people inoculated, and that's Agriland. Jim Maxwell, I spoke with him yesterday on the phone, and I want to congratulate them and along with you. And they've been a great partner. They are moving toward, I think, in the thousands of inoculating people, and it's they've only had one negative circumstance in all of that, and it was due to the person not properly answering the questions of the inoculation requirements, and that person was already getting COVID, and then took the inoculation. And apparently that's not a good thing to do that at the same time. So, but anyway, just a great community partner, always shining in the light. Agriland, just a great organization, and I'm proud of them.
And they worked with the Farm Bureau, Creekside Farming, Specialty Crop, the Almond Company, all working to get their employees vaccinated. So
right. Thank you for mentioning the others as well. I appreciate that.
Yeah, the state has rolled out. One of them is actually happening today with the Almond Company, but pop-up vaccination sites that they have completely, we were involved, but it was really their effort in putting them forward. So the state is trying to really help us in support of getting our agricultural workers vaccinated.
Right.
And Camarina was a big partner on that
Absolutely.
as well. So.
Yeah.
Right, thank you. Any
Mr.
Supervisor
Chair?
Wheeler?
Yeah, thank you. Sarah, thank you for the update. I like those numbers, so I always spread them around. How many doses of Johnson & Johnson did we get last week?
I believe it was 500. I don't quote me on that. I don't have that number memorized.
Okay,
but we administered all that we received. So I'm sorry, that was the amount that we allocated to us when I look back in my mind to what the data I was looking at. We allocated Johnson & Johnson to every provider in the county. So I can get that number for you of what was the total allocation. But it was kind of a bolus at the beginning of what they had in stockpile before the FDA approval. And just like the other vaccines, there's this lull that happens, and then they start manufacturing it, and we'll see an increased supply. But we don't anticipate getting any more for at least a couple weeks.
A couple of weeks.
Yes.
So you just distributed whatever we got to all the different providers?
Correct.
Okay. But I think what you said earlier, getting it to these, the homeless, the farm workers and stuff like that, I think is the most important to use that single shot, because I believe that, it's hard enough to get them to do it anyway. So I think that's very important that we concentrate on using that for that and don't give it to people that we know that will go get their double shots. Thank you.
Very good. Any other questions?
I just want to make one more comment. On behalf of the City Council in Chowchilla, they were extremely appreciative and responded very well to me about the clinic at the fairgrounds in Chowchilla, and they appreciated that because they know there are a lot of people who couldn't travel to get that, and that was right in their wheelhouse. So thank you so much for that. Appreciate it.
And on consent, today we had an agreement to be able to, for another location at the school site in Chowchilla to continue to provide vaccine there.
Thank you so much.
I seen that, and I was just going to say that, Sarah. You're right. It was on the agenda today. So,
Thank you. Are there any members of the public that wish to comment on this presentation? Very good. Well, thank you, Sarah. Thank you. Moving on to item 6D. This is a discussion to consider entering into a letter of understanding regarding a flexible spending account.
Good morning, Chairman, members of the board. Michelle May with Human Resources. Can you hear me okay?
Yes.
Okay. I usually have a loud voice, so I assumed I did today as well. All right. Well, the item before you, I have to say I'm very excited to be here to present this. And of course, if you have questions, open to those as well. But just a little bit of background that may be helpful for you and obviously the public and any of our employees who may be listening as well. So the county currently offers pre-tax payroll deductions for our health insurance premiums. So for our employees who are enrolled in health insurance, anything that they have to pay out of pocket, those are run pre-tax. They have the option. Most of our employees elect to have them pre-tax. So as you may recall, we also agreed with our employee groups a couple of years ago and is codified in our memorandum of understanding or memoranda of understanding with our groups that we would expand our Internal Revenue Code Section 125, which is what our flexible spending is allowed under, that we would expand that to include flexible spending accounts for both healthcare or medical reimbursement and for dependent care reimbursement. And so we currently partner with Alliant Employee Benefits, and they provide the county with some broker services through our partnership or membership with CSAC, Excess Insurance Authority, or our risk management services. They recently changed their name to PRISM, so I still refer to them as CSAC EIA, but also PRISM. So in the county search for the flexible spending account program administrator, one of the things that we obviously wanted to look at was what programs are available through Alliance Help in identifying a good program for employees, but also for the county, and to minimize any administrative costs. And in this case, the recommendation is to enter into a letter of understanding with AFLAC, who partners with Maestro to actually do the flexible spending administration program. So it's through AFLAC, but they partner with this particular administrator. And so part of that recommendation includes the ability for us to also offer voluntary benefits for our employees to elect to enroll into, depending on their own personal needs for themselves and their families. Currently, the recommendation is for 3 additional voluntary benefits programs, which are part of your packet, but those are for the group, they're all group coverage, but so group accident insurance, group critical illness, and then hospital indemnity. And so those voluntary benefits programs, again, are completely voluntary for employees to enroll if they so choose to participate in those. And then we would also like the ability to be able to offer additional voluntary benefits down the road, such as life insurance, things like that, through this program and the agreement. The flexible spending account program, the letter of understanding that's part of this recommendation for the chairman to sign that includes what will happen with that is we will actually there'll be a development of a statement of work between AFLAC and Maestro, who administers the program itself through their benefits portal. And so the agreement that will be developed between AFLAC and Maestro, that's a statement of work and agreement that is also available and will be presented. And so Maestro Benefits Portal will enable our employees to enroll not only in the flexible spending accounts programs, healthcare and or dependent care, but also the voluntary benefits programs that are offered with the flexibility to expand those voluntary benefits in the future. Would that be of interest? So we're proposing an initial short-term enrollment period. Typically, your flexible spending account programs run on your plan year with your health insurance, in our case, a calendar year, so January through December. However, since it's March, the proposal is to do an initial short-term enrollment for a plan year for 2021 for June through December. And then also have a regular open enrollment during the fall, which we do for our CalPERS health insurance, dental and vision programs as well. And then all new hires would be eligible, of course, upon hire for those into permanent positions for enrollment within about 45 days of their start. Very typical to their eligibility for health insurance. So the proposal, there are no administrative costs for administering the flexible spending account program or the voluntary benefits options. So there, which is unusual. Typically, there's an employee cost or an employer cost, but in this case, the agreements with our employee units is that if we were to offer anything, it would be at the employee cost. And so in this case, we're able to actually offer for a 3-year rate guarantee for the employees and the employer. There's no administrative costs. And I think I've just mentioned that there's a 3-year rate guarantee on the program. So the flexible spending account program, you may be aware of it, so I apologize if I'm being redundant, but I want to just share a little bit of background. So the flexible spending account programs that we would be offering would be for health or medical reimbursement for those that are eligible for reimbursement under Internal Revenue Code provisions, and they define what's eligible and what isn't. And then, so both the medical and the dependent care run pre-tax premiums. So anyone who sets aside, for example, $1,000 for the year, because I know that I'm going to spend $1,000 out of my own pocket for myself, my spouse, my family, for co-pays, for glasses, for contacts, for orthodontia, which is very expensive, and many other things, prescription benefits, lots of other medical things. So with that, currently there's a $2,750 allowance for someone to set aside pre-tax up to that $2,750, right, for 2021. And then on the dependent care side, which is not just, we traditionally think of dependent care a lot of times for children. Well, dependent care flexible spending has expanded over the years to also include adults. So we may have family members, parents, grandparents, et cetera, that we have to care for. And those expenses come with that as well for services and care to be provided. And the package that was actually just, the stimulus package actually just increased the annual amount for dependent care up to $10,500 a year for 2021. It's typically been about $5,000. So that may obviously go down in the future, but for now it's $10,500, which is pretty significant. So the plan that we would be proposing would have a $550 carryover at the end of the year. So on the medical or healthcare reimbursement side, if I set aside $1,000 and at the end of the year, I haven't spent that, I've only spent $500, for example, I can roll that over into the next plan year. So there's no penalty, you don't lose that money. Now, obviously with traditional flexible spending account programs, if you don't spend your money that you've set aside within that, either the rollover or the 90 days after the end of the plan year, when you submit your claims for reimbursement, there is forfeiture. That's under the Internal Revenue Code. So if I spend $900 and I don't have receipts, and well, in this case, I'd be able to roll over the $100, but if I had more, then I may lose that amount. One of the nice things about the
the flexible spending account as far as the healthcare is that the proposal would include the ability for someone to have a debit card, which would be preloaded with whatever amount of money they set aside for the year, which is very convenient for any of you who have ever had a flexible spending account program. A debit card is wonderful, and it's very easy to use, and it's utilized, in a lot of places. You may still have to provide receipts if there's something questionable, but that's not required. Someone could do direct deposit. They could do it all at the end of the year and say, I want all of my money, at the end of the year, and because I want a lump sum into my account or to receive a physical check. There are many options to do so. And then just a couple more points I just wanted to share. So on the fiscal, as I mentioned, the fiscal impact, there's currently no administrative costs for the employer or employee to participate in this. Now, we do recognize that, of course, there'll be staff that will be doing running the program, and primarily through the Human Resources Office, and obviously we work with the Auditor's Office on anything payroll related. So it would be set up similarly to what we have for other benefit programs right now. And as I mentioned in the item, there is a requirement to have set aside in the event you need money for people who get reimbursed only for the medical. So just to kind of clarify, on the dependent care, you only can get reimbursed for whatever you've already deducted. So if I have $5,000 and I'm paying I'm paying $100 this month, I can get $100 back on my expenses from each month. So I can't get any money in advance like you can with the medical side. So the medical piece, whatever you set aside, that's available from day one. Okay. And then, we anticipate, based on what's traditionally occurred in other plans, and when you implement something like this, that about 10% of your eligible population will enroll in a medical flexible spending account, and approximately $1,000 per person would be set aside. That may be high, especially initially, but that's the recommended amount that we set aside, 5 to 10% of that total dollar amount, which in our case, for about 1,400 employees, 10% at $1,000 each would be about 10% would be $1,400. So it's not too ominous. And as I mentioned in the item, our current self-funded dental and vision accounts do have sufficient funding, and have traditionally had sufficient funding to be able to absorb that on a temporary basis. It would obviously be paid back by payroll deductions. I think that's all I have. If you have any questions for me.
Very good, thank you. So we have Supervisor Rogers.
Yeah, this is similar to an MSA, am I correct?
So like a medical spending account? I don't know if you're referring to medical or health reimbursement account.
Medical savings account, yeah. Health savings account, same.
So yes, so my understanding of the difference, the health savings account doesn't have a use it or lose it or end. It actually rolls over.
You can accrue.
Yes.
Yeah.
And
So it's a little different in that regard.
Yeah.
Do pharmaceuticals apply as well?
Yes.
Okay.
Yes, absolutely.
And you said 3 years with no administrative cost.
That's correct. So
once the 3 years is up, administrative costs kick in. Is that per employee? They're going to deduct that from the program as you make your deposits into your thing that comes out of your pot?
Yes, if there were an administrative cost down the road, and obviously we'd have the ability to negotiate with this vendor or even a different vendor at the end of that period.
What do we anticipate that administrative cost would be approximately? I mean,
so I have seen them from about $2 to $4 per employee per month, which doesn't sound like a lot per month, but it does add up,
right.
Certainly, and that's currently. Can't necessarily speculate what it would be in the future, but obviously our goal is to try to minimize or not have any administrative costs.
Okay. So when you say you can roll over $500 a year
yes.
into the program,
Mhm.
let's say you put in $1,000 and you use 500, you have roll it over into the next year.
Correct.
So next year you're going to have $1,500 and you use $500. Can you still only roll over 500?
So right now, it depends on the IRS amount. Right now, it's $550, but that's a really good example. So one important thing to note with the flexible spending account programs, you have to enroll each year. So you're not automatically enrolled. You have to complete the enrollment forms to sign up each year.
Yearly.
So if you had $1,000, spent 500, and then we rolled 500 into 2022, for example, then that $500 would be utilized first. And then whatever you signed up for 2022, so if it's $1,000 more, then that $1,000, you'd start chipping away at that after the $500 carryover. Does that make sense?
Yeah.
Okay.
So you could potentially lose money that year.
You could potentially lose money, yes, if you don't have the, if you don't have expenses, yes, absolutely.
If you don't have the foresight to think, okay, I'm going to have less expenses, or I've got more money in my pot, so I'm only going to take out 500 instead of 1,000.
Right. And that's one of the things with the
That's
enrollment.
good about the yearly renewal.
Absolutely. And one of the positives with the enrollment period is that we have the ability for the vendor to do one-on-one appointments. We can do group appointments. I would love for us to be able to do in person, and hopefully or possibly we will by fall for our open enrollment. Fingers crossed we'll be able to get to do our health and wellness fair in person again. But yeah, so we have that, definitely have, we want to make sure that we educate our employees and make sure they understand the provisions of these programs, because it is very important that they understand.
So that's pre-tax money, and once that money is used, it's never taxed, right?
That correct. It is deducted from
Tax-free.
your payroll, pre-tax. Yes.
Thank you.
Yep.
Supervisor Frazier.
Oh, I forgot I had rung in. This is the perfect example of wait till the presentation is done, because sometimes all your questions are answered. Like I literally I forgot I was up here. I'm sorry.
Okay, very good. Supervisor Gonzalez.
I got one too when she gets done.
Okay.
Michelle, thank you. Can you tell us was there a bidding process for this, or how did we go with this company?
Great question. Thank you. So as I mentioned, Aflac Benefit Services is the broker of record through our partnership and membership with CSAC EIA PRISM. And so part of their role is to actually vet the vendors, and they do the search, and then they provide. We actually started this process several years ago in looking at some options. And so they provide different, they may have 2 or 3 or 4 vendors for us to look at and make comparisons. So yes, they actually do that process on the county's behalf. Great.
Supervisor Wheeler.
Yeah, thank you. Well, I've talked to some insurance companies and they're not really pleased with AFLAC responses and paying things out and stuff like that. So I don't trust them just by what insurance agents have told me about them. And I didn't see no contract in the backup with the Merrick or whatever the name of that company is that's going to run it for them. David asked the same question I was going to ask about the administration costs. So they're obviously going to do charges. When they do the administration costs at $2 to $4 per month, is that paid by the employee or by us?
So that would be paid by the employee, and that's our agreements with our employee organizations specifically indicates that any costs would be borne by the employee.
Okay. But the first year, 3 years is guaranteed no admin costs, right?
I'm sorry, Supervisor
The
Wheeler.
first 3 years there is no administration costs.
Yes, and the rates that are quoted are guaranteed. So any employee who signs up for something, those rates would be set for the 3 years.
Okay, is there a rolling amount of rate cost by what they choose to have covered?
Yes, so each of the voluntary benefits programs, they do have various premiums and types of ranges of coverage. So for example, the group accident coverage ranges from about $14, so that's 14, to about $40 per month. They have 4 different categories, so employee only, employee plus spouse, employee plus children, or family rates. And so that $4, as you might imagine, is going to be for employee only. And then for family would be about 40. And then the others also have just different categories of eligibility.
And this is almost like a life insurance policy, isn't it?
But it's non-taxable.
Yeah, correct. It is very similar. You're right.
Yeah. I has our staff, I mean, our employees asked for this in the unions or anything, or is this just something that we came up with?
No, yes, as a matter of fact, there's been a provision in the MOUs for many years prior to my even being on board with the county that just indicated very briefly that we would offer a 125 plan and that we would consider expanding that at some time down the road. And so in mid or late 2019, I believe, we entered into agreements with the bargaining units indicating that we would expand the program to include the flexible spending accounts that we're talking about here specifically.
Yeah. And what if we don't get 10% of the employees to do it?
To sign up for flexible spending?
Right.
That's not a problem. It's however many enroll. There's no minimum.
Charge us more if we don't get that 10% threshold.
No, there's that 10% is just an indicator for how much money we may need to have up front. If people, let's say everybody, you had 10% enroll, and then everybody turned in their expenses for their maximum amount they set aside, like in the first month. Then obviously we haven't collected that much through payroll.
Yeah. In the backup, it's got a deal on there, 4 circles, and then for cancer, and then the last thing says you'll get $10,000 if you get cancer. Explain that one to me.
So the voluntary benefits programs, essentially what they offer is they have different dollar values for different items depending on which one you're looking at. So there can be money reimbursed directly to the employee if they enroll for both medical expenses and then also what they consider to be life or living expenses. So it varies depending on what may have occurred and under which program.
Yeah.
Read the
well, this one says cancer, and it says up to $10,000. I mean, so does that mean if you spent that, you'll get $10,000? If you're Blue Cross like I have, don't cover it, or is it you're just going to get $10,000?
So the way these particular programs work is it's a dollar amount that you would get regardless of, in some cases, regardless of your health insurance. It could be a dollar amount out of your pocket. It could also just be a flat dollar amount or percentage based on whatever occurred. So it could be $10,000, for example, is the maximum for medical and living expenses, is using that term. So it varies specifically.
So you could sign up and get that. So that would be more than that $40 a month then, right?
That's on the accident.
I don't know. You just said that it's $40 a month, and you said that would be extra if they had that special deal that had that. I wish I do that on my iPad, so the backup, and I don't have the backup any other way.
Okay.
I was going to print it out, but there's too many pages and colors, and they eat up my little copy machine because I didn't quite understand that cancer deal where it had $10,000, and I just wrote a note on mine. If I got that $10,000, does that do I get that even though that Blue Cross paid when I had prostate cancer? They paid for almost everything except for I guess my $5,000 deductible, but they paid for everything else. So I'm just wondering, would I have gotten a $10,000 check on that?
So it's going to depend on what the coverage includes. So if it's a $10,000 flat fee for medical or whatever you had to pay out of pocket, or if it's just for living expenses. So it just depends on how it's written. But just Supervisor Wheeler, I just wanted to clarify on the dollar amounts that I mentioned, that was on the group accident, those rates that I was mentioning earlier. You're looking at the critical illness benefit, which includes the cancer and stroke. And so they have different dollar amounts, and the coverage amounts actually range. So they have from $5,000 up to $50,000. And
Yeah,
so,
I've seen the 50,000. So what, so that would be more than that $40 then a month.
so yes, it depends on which, so that one actually, the lowest out-of-pocket per month cost, and that would be the $5,000, is going to be just under $4 a month. And it can range quite a bit up to about $260 a month, depending on if you are, for example, a tobacco user, and then you're at the $50,000. So if you're at the highest benefit, and they do have, in that case, they have tobacco and non-tobacco users. As insurance companies sometimes do utilize things like that, of course, if you're a tobacco user. So the rates are a little bit higher for those.
Yeah. So what's the maximum amount? If they got all the big fancy things there, it's on that plan, what's the maximum amount that they'd have to pay per month?
The maximum amount that an employee would have to pay?
Yeah.
So if you
they
went-
had a family and of 4, say a family of 4, and they want that cancer and they want the smoking and they want the strokes and the heart attacks and all that other goody shoes. You're saying
Coverage for those things, I think, is
going
the
to make a lot of
Yes.
people say hey, it's going to be real fine. But
So-
when I was looking at that whole package,
Yeah.
it had to be more than $40.
Oh, absolutely. So if you had an employee and then they also covered a spouse, so you could be looking at, depending on your age, if you're a smoker or tobacco user, sorry, I think they just use the term tobacco.
No, that's
And-
okay.
And the maximum benefit, so $50,000, you could be looking at several $100s a month. So it's from
So this is like an insurance policy then.
That's
If you want
exactly-
more
that's
money,
exactly correct.
Coming in, you pay more damn money. I just don't like it myself. I don't know. I think we'll sucker some people in that can't afford it. I don't know if they got their good insurance already. I don't know. And I don't trust Aflac, and I don't see a contract with who they're dealing this with. They're not going to be doing it, obviously. They got somebody else who's going to be doing it. And I mean, maybe you got confidence in them. I don't know. Maybe you know the company they're doing. I don't. And the public won't know. Our employees, anyway. The public don't make any difference. Okay, that's all I have right now.
Okay, very good. And before CEO Varney, he's got a comment. I'd just like to mention, frankly, I'm surprised that Madera County's taken this long to come up with a 125 plan. For decades, there have been businesses smaller than ours that have had 125 plans, and how we've been kind of Johnny-come-lately to the scene. It's really stunning. These things are very popular with their employees. Employees can take what they want, don't want. It's one of the most inexpensive employee benefits you can provide for somebody, and you can pick and choose what you want. And it's a tax saver. I've used them in the past. They've been I'm talking 20 years ago, I was with organizations that had these plans. So again, they're outstanding. There's no reason why we shouldn't be moving forward. And again, we've been in the dark ages for not having a 125 plan in the past. CAO Varney.
We had at Papa Murphy's, kind of to add on to that, because I was going to say that after Tom's comments about, I went and just asked, how do I put into my 125 plan about 2 or 3 years ago, figuring, it was just based on an assumption that we obviously had one.
Yeah.
And when I found out that we didn't have one, I was shocked. And it wasn't just the employees, Tom. It was I was asking for it because, it was shocking to me that we didn't have one.
It's unbelievable.
Yeah, it really was.
CEO Varney.
Thank you. These are generally referred to as cafeteria plans, and the idea behind that is you pick what you do or don't want to eat. This is in addition to or secondary in terms of discussion about Aflac to any other insurance you have. So we aren't requiring the employees to participate. It's what they feel that they need to protect themselves or their family. And then going back to Supervisor Wheeler's question about would the $10,000 be paid out even if Blue Cross or whoever's insurer is paid? The answer to that is yes, if you meet what AFLAC's requirements are, because again, this is not your medical insurance, this is secondary. So if you meet the benchmarks that they have in your policy, then they will pay you whatever the prescribed benefit is, as would any company of this nature that we deal with that deals with secondary insurance.
Very good. Any other questions? Comments? Anybody from the public have any comments? If not, I'll accept the motion
Move
for
to
action.
approve. Second.
We have a motion and a second. Roll call vote.
Supervisor Frazier?
Yes.
Supervisor Rogers?
Yes.
Supervisor Gonzalez is absent. Supervisor Wheeler?
You know, I'm gonna vote no. I'm just old fashioned. I don't get it. I haven't even heard of it before. Obviously, you have, I guess, Chairman and Brett. I just don't understand enough right now to vote yes. So I'm gonna vote no.
Chairman Poitras?
Yes.
Vote passes 3-1.
Okay, very good. Thank you.
Thank you.
Thanks for the presentation. Moving on to our update on Mission 2023. Mr. Varney.
All righty, thank you, Chairman. First of all, I just want to say thank you to Melissa Da Silva and the other principal people who are somewhat in charge of the 8 areas within your plan. We're going to probably move pretty rapidly through today's slides. There are quite a few slides, and I don't want to belabor some things that you're already familiar with. So if you do have questions, we can either go back or ask me to slow down. I'm not going to read them word for word because some of these slides are pretty busy. So here we go. So the overall for today's presentation is just review your plan, go through the focus areas, run through some survey results with you, and then at the very end we have a few, just a few recommendations of going into the future. This is a timeline of what you've accomplished in the past, dating all the way back to 2018, and then moving ahead. Obviously, we were canceled last year, and as with so many things related to COVID, we continue to move forward on these. We've tried to include the survey results in this particular presentation just to give it a little bit of freshness and to show the board the feedback that we're receiving. So here are your current mission, vision, and values. I won't read those back to you, but under the values, we changed the slide just a little bit because we do appreciate that acronym and we're trying to adopt that countywide. Don't ask me to repeat it for you once the slide moves on because my memory's getting old and I probably get through the first 2 or 3, but I might drop off at compassion and excellence there. But it's professionalism, loyalty, accountability, compassion, and excellence. And here's your strategic focus areas. It's the 8 that we've been dealing with throughout this strategic plan. Community, employees, public safety, public information, technology, infrastructure, government relations, and health. So we're going to do a little bit of review in each area. Again, we'll try to make it as brief as possible. I know that the board has a lot of this, at least the concepts committed to memory. So under community, your strategic objectives are listed here. All of them, obviously, since they're all under community, they all kind of go together. So one of the things we wanted to point out to you was the number of grants and things that we're trying to get to assist community under this particular bullet item. And you can see that both the number of grants submitted and the number of grants awarded has gone up from 2018 through 2020. I think if we did perhaps a review of the last 6 months, the number granted would be up even higher if we compared that 12 months to the previous 12 months. Staff has really been working hard at bringing grant money in, as has Tristan, in terms of helping to coordinate those submissions on behalf of the county. The most recent one that I signed off on was one that you're previously familiar with, which is 5 grants of $20,000 each for alternate fuel vehicles, in this case, hybrid vehicles for the sheriff's office to replace regular regular police interceptors. And so with those now being approved, we'll get those ordered and out on the road. Again, in terms of demonstrating community during this past 2020, I mean, how many more disasters do we need, right? Between COVID, the creek fire, ongoing drought and tree mortality, and now the mitigations around the Mono wind event. I think that the staff overwhelmingly demonstrated their commitment both to the employee community, but more so to the greater citizen community in carrying out their roles within the Madera County mission. And then we did go forward with a customer satisfaction survey, and this was implemented through the 311 or the Madco Services app. This is a survey that's ongoing, so some of these results may change from month to month as we get more and more feedback to those. And let me stop here just for a second. Supervisor Wheeler, I didn't ask at the very beginning. You can't see the slides, correct?
Yeah, I can see them. I'm watching them.
Okay, sorry. I can't see you, so I thought for a minute maybe you couldn't see us. All
I
right.
tried to take me off so I see the whole picture, but
Yeah, well, perhaps the slides are prettier than you are today. So,
Yeah.
all right, we're going to move forward here.
that won't take much. So,
All right, so on the customer satisfaction survey, you can see that over the time, the number that we've generated, it does not equal the number that have been completed, but over time going 2018 through 2020, you've actually had probably, in terms of gross numbers, almost 150 more completed in 2020 versus in 2018. And that's from a percentage standpoint, that's a pretty significant increase. And then here, we're going to go through a number of slides here where we've tried to group together some of the responses. Some of them may come out with the percentages being kind of low in terms of the positive, but keep in mind that this just aggregates the top two: strongly agree or agree. It doesn't bring in neither agree or disagree. So here is one that specifically deals with being provided prompt and professional experience. I have a feeling this it may go down this year only because the 311 people are under a significant amount of stress working on behalf of public health. And I'll just make a note of, for a year now, because today is the anniversary of the day, the board declared the emergency last year in 2020. So 311's been working for a year for public health. And with that, we do have some delays because your regular run-of-the-mill customer also is accessing the county through 311. So while those folks are completing all those reservations for people who aren't tech savvy for vaccines, they're also trying to deal with our regular community members who just have a need. They want to report a pothole, or they want to report a dog, or just whatever have out there. So pretty high percentage going away satisfied at 84%. Next, we have a couple different graphs in the same vein. They came out with the exact same percentage. Visiting our office, I was able to get not only the information I wanted, but we also provide a trusted service, and they trust the information that's being provided, and that's at 77%. This slide just aggravates some of the things that were accomplished between 2018 and now. In particular, the website was significantly changed during that time, and there's still some ADA-related items that we're just touching up to make sure we're in compliance. And certainly, as the pandemic goes on, both in the public health, daily notifications, and other ways, accessing county services through the website is extremely important for our community. Okay, this slide I can't read from here, but this is actually an engagement slide. It shows you both graphically and in a bar graph the number of visits we've received. So you see in 2019 we had just over 711,000, and in 2020 we've more than doubled that. And that's calendar year 2020. I know we're almost always talking about fiscal years in this room, but this is for your calendar year. So we're up over almost to 1.6 million visits in 2020. And I think for a county our size, that's pretty significant.
Amazing.
Okay, this is a synopsis slide about how we're trying to engage homelessness as it relates to focus area number one. It goes back to the board's request of the then Behavioral Health Services Director, Dennis Cook, to engage a strategy to reduce homelessness, and we have now transitioned to, the director of CAPMC, Maddie Mendez, to act as our homelessness coordinator, homelessness liaison in the county. There's certainly a number of goals there. I don't want to read them to you. This is actually available to you in your board pack. It's also available online. And see, we're doing enough things that we've actually rolled over into 2 pages. I think this might have even started out as 3 pages. 2 things I would like to highlight that are good things both for our community members and for the county as a whole is our increased participation in the Fresno Madera Continuum of Care. A lot of that has been accomplished through Joel Begay and Matt Treber in engaging the FMCOC, along with your Department of Social Services and your Behavioral Health Services Department that were already engaged there. But we've kind of upped our anticipation of participation because, frankly, we feel like Madera County should have access to more of the funding there. And actually, we've been we've received a very good welcome from the existing FMCOC people on behalf of Madera County. And then the second item is that through some work with the Housing Commission, the Housing Authority, Madera Housing Authority, and CAPMC, we've started to stand up a triage center. It's in about the 800 block of Yosemite for people who are homeless. And we have some thoughts going farther down the road into years of the future of a more substantial facility to be able to triage some of those folks. Okay, focus area number 2 is the employees. Employee wellness is obviously a very important thing, both to the individual employees and then to us as an employer. I think it's, if you've talked to the employees who've worked elsewhere and then come here, they all, to a person, have commented on, number one, how much more they know about their immediate supervisor and those supervisors above them, how much friendlier it is here versus perhaps where they came from and how they feel fairly engaged. Some of those things aren't fully reflected in the survey results that we'll show you, but I'll just say anecdotally, when we talk to people who worked in other county government, they really appreciate working here. So we've done employee survey satisfactions now for 3 years, and these are voluntary, they're confidential, and you see that although we're up to, well, I don't know what that is percentage-wise. We have between 1,300 and 1,400 full-time employees.
Close to half.
Yeah, so to get 750 to take the time to fill this out is actually pretty impressive. So let's roll here into the results. So I'm going to have to read off the screen here because I really can't read that one. So in terms of the percentages that are tracked here, some things say 100%. It's any place from 0 to 100%. So I'll just draw your attention to one that's probably one of the easier ones to explain. If you look at the 80% gray bar graph that stands alone, it's 3 from the right. It's under or over the heading of update new employee orientation to include mission, vision, values, and customer service. So some folks would measure that and say, well, you've done 100% of that because we did new employee orientation. We did 2 rounds of it in December. However, there are still some things we would like to roll into that presentation, and in terms of making it a habit, we just didn't quite feel like we could call it 100% completed. And in terms of the other items on here, they also show some level of a kickoff or some level of progress in terms of where we're at. One that, for me, as the CAO, I'd like to see us make some progress on this calendar year would be the develop the succession planning. But that's kind of behind all the other things that we need to be looking at. But obviously, a good succession plan leads to long-term successful government and government continuity. Other employee wellness items here, you can see we did the survey as mentioned earlier, all 3 years. We have begun to identify desired wellness programs and policies. HR is working on developing a wellness campaign and identifying and promoting existing wellness programs and policies. Even today's insurance item would fall into those areas. Another thing that I'd like to add here is we have, with the help of Jason Blanks, finally kicked off having countywide safety meetings with the safety representatives from each part of the government. We started those in November, and certainly safety and wellness go hand in hand. Okay, so here's some of the results from the survey. It shows things that the employees are interested in and things that they look at from their personal point of view. You can see that a vast majority of the employees are interested in stress management training, and about half are interested in some sort of work-life balance program. So this question here I'm not really very happy with, because frankly, how do you know if you're satisfied with the Madera County Employee Assistance Program if A, you've never had to use it, or B, none of your close associates are? So we're going to do a better job through HR and through other department representations to push out to the employees more of what's available. Obviously, this is a highly confidential area if you're dealing with the EAP, so it's not like we're going to go up and ask people, hey, how was your counseling session last week? So it's difficult for us to get face-to-face information on this. This is purely in response to the confidential survey there. So I think if we could get those people in about the fourth bar down, neither agree nor disagree, to understand more about the program, then perhaps our numbers here would look better and our employees would be happier with our program. And then obviously for most folks, their overall health is extremely a high priority for them, 94% of them. However, just slightly over a third feel that their overall health is a priority in terms of the county folks. And again, this is an area that we need to do some work on and move that, the way that chart is it's kind of centric. If you look at the middle, that's where most of the people are. We would like to get the idea and the programs out to the people so that they feel like their health is a priority to us here at the county. The next one was a question about healthy food choices. That's pretty subjective because we have people literally stationed all over the county with all sorts of different opportunities to eat or not eat. Obviously, if you're in this building, you have a lot more choices than if maybe you're over on Almond Avenue if you don't have access to a vehicle to take you to lunch. So the more slides here about other employee opportunities and stress management. You have 57% of the folks feel like they're able to deal with their stress level and to be fully present at work. And again, that's an area that I think every employer is dealing with, probably even more so after a COVID year like we just rolled through. Overall, we have a high engagement on people using health screenings and annual health care and counseling service visits. So I think that's a good trend to continue to follow. So going back to the more standard slides here, we have a whole list of things that are pretty much the same as some of the things that you saw in your graphic slides earlier. But we're still working on implementing an active shooter training program for all work sites. Obviously, we just talked about EAPs, wellness programs, staff development, and other things of that nature. Some of these will be much easier to re-engage once things are red or orange or fully open. The third area is public safety, and we'll just roll right into that. This chart here, again, is just a graphic representation of where we think we're at with a whole lot of different programs or projects. You see that you have a few that are 100% established, a few that are 95%, a few in the, actually quite a few in the 50 up range, and then you have a few projects that were just beginning to get started on. And I would probably refer this one back to you to review on your own time. If you have questions of us or the representatives from this focus area, we'd be happy to answer or explain those. But in this chart itself, we could spend 30 minutes going through. But you see some of your projects that you're well aware of and that the board supported, both personally in terms of your vote and your support for your districts in the county as a whole, and in terms of approving the budgets for those projects. Okay, public information. So obviously we're continuing to market what we think Madera County has to offer and what the Madera County story is. We are working as strategic objectives to improve community member satisfaction, continue our branding along the line so that it's coherent but not so rigid that people can't adapt their individual departments into what we offer. and then to just continue to monitor and improve customer service. So the public information side, here's a bar graph of some of the things we've done to develop customer service. Well, that's a tongue twister for me right now. Customer service survey, and we've done that for 3 years in a row. We've reassessed and updated, and the board just voted in February the PIT team makeup and the policy that goes with the PIT team. And then we're still working on developing the quality of life campaign as it tells the Madera County story. And again, it's kind of tough to tell the whole story when everyone is in some level of lockdown. Okay, under 5, technology. This is one that almost defies description because it says implement dynamic, flexible, and innovative solutions. And in some ways, solutions change almost from year to year. So we've been working hard with IT on this one in particular, and with the other entities that have IT-related projects that may not be the specifically under IT for completion. And obviously, this is outside of our buildings. The technology infrastructure is probably our most critical infrastructure item. Again, here's some technology action items in the state that we think they are in right now. Okay, focus area 6 is infrastructure, and for the most part that means development of buildings, renovating buildings, or things of that nature. And here is another entire list of those items that were previously identified under this focus area as things that you want to get done. You see you have a high level of completion in this area, so we're probably going to be going back with the infrastructure group and bringing some new goals and objectives back to the board. Groundwater sustainability plan was completed in 2020. The ag center that you've moved the ag department from is there's just one little item that needs to be fixed over there. The third floor room is finished. The library's finished. The sheriff's substation is finished. HHS facility is finished and open. And we have reached out to the other 2 governments in December about continuing the intergovernmental meetings. I have not received a response from them, but perhaps when we get back into red, we can reach back out to them and encourage them to meet face-to-face. One of the other councils is meeting face-to-face. I believe one is still meeting virtually. So maybe when we're all back to face-to-face, we can get back together for an IG meeting. And that's basically what we're talking about here under intergovernmental relations. I think in terms of cooperative projects, whether it's the Y area of the high-speed rail or anything else, I think at least from the CAO perspective or CAO to city manager to city administrator perspective, we have wide open communication. And here's some of your goals in the past here in terms of developing surveys and having an annual meeting. And of course, you can see in 2020, we did not have the annual meeting because of COVID. Here's just some areas that you literally talk about at the board every week. There's something from this list in front of you every week. And sometimes it involves other government agencies, and sometimes it just involves the County of Madera. And then the last focus area is health. And this specifically has to do with engaging the system. This isn't the same as wellness that we talked about earlier. It has to do with engaging both the mental health and the physical health system so that the county as a whole, that the residents as a whole, and our employees maintain a healthy predisposition. And there on this one, we have a list both of mental health trainings that were accomplished during your previous 3 years, and then goals. And again, you see you have a number that you have reached as a county, and then some that we need to get started, which frankly were put on hold because of COVID, which is now a familiar refrain. Okay, so this is almost the last slide here. So want to review these focus areas just to make sure that they continue to be where we want to focus. And as we've already discussed, there's some where we need to come up with some new goals related to them. We want to continue to provide these timely updates to the board. And staff would recommend to you, right now we're trying to put together a one-day version of the management workshop that we used to do in a day and a half. That would be down here in Madera. It'll be in the third week of May. But we're going to come forward to you with what we'll call the next step from this plan. So if you recall, back when this plan was put together, there was no plan. So you've gone from, I don't want to say winging it, but from having a less cohesive mindset about what we're doing to a pretty cohesive one where everything that we do, every board item each week fits into one of these 8 areas. But staff believes it's now time to take the next step to a more long-term, more comprehensive strategic plan where we work with the board, with the community, and with the employees to establish stronger areas up above these simple areas. I mean, we have some plans from some pretty complex counties that we would roll out to you and look at it, and I think you'd look at it and go, wow, that's simple. You know, LA puts all their things under three categories. And then the things that we're discussing now as our strategic plan would be support things down underneath those 3 particular main items. And the main idea, not only do I believe it's good government and it's good for the board, but the simpler we make the plan, the more your employees will actually adopt it and be thinking when they try to think of something new or how to do something different, they'll be focusing on those areas. So for the board, that's part of our plan for the May meeting is when the board is completed doing what it wants to do amongst themselves, is to have a facilitator there to help you move, at least start, because it'll take a significant amount of time to develop this plan. I'm thinking up to 12 months. And then that will be your plan going forward for years, just like this one was designed to go for 5 years. And very last one, we just put the cool logo back up there with what we're here to do, create a county-wide culture of excellence through dedicated public service. And we're available for any questions that you might have.
Thank you, Jay. Great presentation and impressive results. Supervisor Frazier.
What a beautiful logo.
Yeah.
I love it. Compass.
First of all, that was great, and I love the end of that. And I think that kind of touches the point that Rob, you made at the beginning with this needs to be a longer deal, and this was just to get us to that point and to get some data collected to move forward into that strategic plan moving forward. And I think we're finally at that point where we can do that. And on the surveys, I always, I do customer surveys for Papa Murphy's, and it's easy to look and say, oh, 85%, that's great. Well, you can take 5%, they're not going to be happy anytime, but how do we get that other 10%? Like, what is it that we can do better? It's a way to get better, and I think that we were looking at that. On the EAP, I think you saw the biggest line, or the biggest part of it was the neither agree nor disagree, and what that tells me is I don't know what it is, so I don't agree or disagree with it because I don't. So I think the education piece is the important part of that, of what it is, how it helps them all the way back to. So the grants that we received, do those also include special districts, or is this just for county grants?
I don't have a specific answer. My guess would be that is all grants that ran through Tristan or through one of the other entities. And Melissa put this initial together, and I see her coming in the room, so maybe she has the exact answer for you.
And then another one of the questions was on the public safety portion. It had there was a 5% line. I was looking for all the low ones, but it had to staff and equip the deputies per the development agreements. And
so that's one of the weird ones.
Because I know that they're funding them as they're supposed to. Is it just for the whole? When it's
Yeah.
full
So-
build out?
Yeah, that's a measure of how close, yes, sir, to the end of the full build out you've
Okay.
gotten. That's not have the developers come through with what they should have gotten.
Yeah, I was like,
through
'cause
already.
I mean, I know that they were paying for those and it,
It'll
but
probably
5%,
be-
I was like, oh no, we've got to,
Yeah.
we've got to put a little bit more pressure on there, but that's
Yeah.
at the full build out.
Yeah, if we continue to list that one, that's probably going to be 10 or 15 years before we get there. And Melissa has an answer to your previous question.
Okay.
Good morning, Chairman and members of the board. Melissa De Silva, Chief of Staff to Supervisor Frazier. And the information presented with regards to the grants were only those in administration that Tristan worked on. Does not include any special districts.
Okay, because I was like, I know that we've, just knowing the amount that we've had in the special districts, so that's a great answer.
Right.
And then, let me see if I can read. And the Area 7, I also think that we should just highlight in there, because I know we work a lot with the school districts, State Center Community College District, just highlight in there that we have those as one of the things that we need to get better at and continue to do the good work that we're doing with the school districts, because they're an important piece of all of this. So, and I think we're doing a very good job with it. But you know, even just a couple years ago, I know there were some issues in terms of communication. It's easy to talk with the cities and the state because we speak somewhat the same language. Sometimes we need an interpreter to go between school speak and local government speak. So we just need to always continue to get better at that. And that's all I have. And thank you for the answers.
Thank you. Supervisor Rogers.
Yeah, I just want to restate what I think is probably one of the more important things we can do as a board and as an organization is to come together and establish goals that are they're stated, they're achievable, they're measurable, all the elements of goal setting that you need to have. And if I've said in the past, and I'll just say it one more time, I know it never gets redundant for me. A failure to plan is a plan to fail. And it's important to not only recognize the setting these strategic goals, but to also evaluate them over time and be able to change under circumstances. One of my greatest disappointments last year was the inability to effectuate the goal-setting process with the organization, because we were in the throes of complete change, and it made for management by triage rather than by objective. And so muddling through that process was a little bit fun and different. But since that time, we've had a number of new people come into the organization in key positions. And one of the important aspects of keeping ownership involved in goal setting, which is a key phrase, I think, for accomplishing all that we've accomplished, ownership is a necessity for this organization from the top to the bottom. And it's important to have their input, the new people, and one of my desires is to see this filter down through the organization, not just to the middle, but all the way to those who, in the line positions. And I don't mean I don't want to use the term bottom because it's not the bottom, but it is it's where the rubber meets the road, so to speak, and it has to filter down through the organization. So ownership is going to involve getting these goals to our line employees, not just management and all of that. And that was going to be the focus of some of our goal setting last year, because we were at the 5th year of strategic goal plan setting. So I think I'm trying to say we don't want to become stagnant in the process. We need to keep it alive and new and including the new people and including other employees and other circumstances. And another way to do that, not only through ownership and getting everybody involved, is to include other methods like a needs assessment, management by objectives. We're using strategic planning because it's an excellent tool. But there are so many other tools in the war chest that are effective in the meantime as well. And it keeps the goals fresh. It keeps them alive. It keeps them in flux because they need to be, because we're in a flux situation, and that's where we live. As an example, adding the idea of remote working, that was a necessity, and we need to have that on the table just to be able to filter that out, how that's going to work, how it looks, how do you manage that, those kind of things. And lastly, I just want to say what we've accomplished in these last 5-6 years is remarkable. It's nothing short of amazing. When you see 100% fulfilled goals, I'm excited out of my head to express to the organization what that says about what we are as a group. This is a great thing that has happened. Thank you.
Supervisor Frazier.
Sorry, I did miss one of my things in it. David sparked it. So not just it filtering down, but how does that communication go kind of vertically, horizontally, however it needs to go? Like on our surveys, we're asking the questions that we think are important, but is there a place for them, for our employees to be able to put in suggestions of things that are very important to them? I think listening and hearing those are just as important as us trying to throw everything that we think is important, but for them to be able to have that same communication throughout the organization.
Thank you. Are there any other questions or comments?
Yes, please.
Yes.
Thank you, Dave. Great update on that. That's so important that for the whole organization, like Dave and Brett both said. I think it was plate 6. You had 2 or 3 of mine, but I had that chart of what percentage of stuff we've got done in IT. Was that the 4th from the right on that chart? I think it said Government Center, but I believe it. I couldn't see it because it had the pictures on the bottom. Was that the Oakhurst Government Center at 40% done?
I think you're right, Supervisor Wheeler, but I don't think I have the right page. Bottom, you have the page?
Well,
maybe, let me roll over one
next
here.
plate was 7,
Yep.
number 7.
Yep, I got it. So completion of Oakhurst Government Center, yeah, that's 40%. So,
Okay, I just wanted to make sure it was the Oakhurst Government Center. I figured it was,
yes,
but I
sir.
couldn't see it on my screen at the bottom. So, but thank you on that one. And then when they were talking about ownership, our employees, they are the ownership of this whole deal. I mean, we're the leaders. We're only as good as they are. That's what makes us look good. So I really like to, even the idea of what Brett said about is there places where they can ask questions that we might want to put on the survey. But I'd like to even have a workshop maybe just for the employees, a couple of them if we took it, to get them involved with this survey when we do it this year or whenever we're going to do it again. I think that's really important. And our other thing, last thing is, are we going to, if we do get opened up, are we going to try to do our workshop at Bass Lake this year, or are we going to wait till the first part of next year?
No, we're going to do the workshop here. It will be off-site. Right now, we've tentatively picked the 20th of May. That's a Thursday. And then we'll have to see how that goes, and then we'll look at where we're going from there. The place that we're having it will allow for social can't spit it out, distancing.
Yeah.
And then it will be a one-day event down here.
Okay.
And then going back to the question about the questions getting feedback from the employees, there are 2 questions at the end of the survey that are open-ended, so people are able to add their
Great.
ideas there.
Like Brett said, that's important, you know, that, but we need to get more than that, whatever it was, 30%, 40% or whatever.
Hey. Yes.
Actually, Jamie had one last thing she wanted to add that's responsive
Okay.
to questions.
Mm-hmm.
Hi, Supervisor Jamie Bax with Planning. In regards to the infrastructure question on the Oakhurst Government Center, yes, that is the Oakhurst Government Center that was moved from Bass Lake, if you have any questions on it.
Okay. No, I just wanted to make sure that's what it was. I just couldn't see the bottom of it. So thank both of you. Thank your whole staff for doing this, man. What a deal. So.
Very good. Any other questions or comments? Thank you so much, Jay. Appreciate it. Next item is item 7A, and this would be a discussion and consideration to authorize a letter of opposition to SB 286, as introduced by Senator Min. I believe that this is a bill that would, if you won an election in the primary, the top 2 vote getters would still have to go to.
Chairman, I can address that just real quickly. So yes, you are correct. It's a bill that would require the top 2 vote getters to proceed into the general election. I think it would be, having been elected, that would not be something I would have looked forward to, but certainly leave it to the consensus of the board on whether they wish to support this letter of opposition that was authored by Mr. McCauley.
Move to approve.
I move we approve. I second the motion. I mean.
This is again, Rob, just what you've said, someone trying to take care of something legislatively to take away the voice of the people. And
Absolutely.
And all it does
Fully
is
100%.
Yeah, and you want to have problems with fundraising, create an entire year of strife and anguish onto it's ridiculous, and
right,
like a third it, fourth it, whatever.
It's a
you got to win something twice.
Yeah,
it's a dream for the campaign chair or the campaign managers or that industry or whatever.
Yeah.
You know. Any comments from the public? If not, I believe that we've had a motion.
Yep.
And a second.
Yep.
Okay. Roll call vote.
Supervisor Gonzalez?
Yes.
Supervisor Rogers?
Yes.
Supervisor Frazier?
Yes.
Supervisor Wheeler?
Yes.
Chairman Poitras?
Yes.
Vote passes 5-0.
Very good. Thank you. The next item we're going to consider is one of the items we added onto the agenda, and it's regarding the changing the status of the metropolitan service areas from 50,000 to 100,000. It's a very arbitrary number, and it would not only affect Madera, it would also affect about, I think, about 1/3 of the metropolitan service areas across the United States. Any other comments? It's just bad.
I think that is very accurate, and it definitely will cost our area and our state money.
I move to approve the opposition.
Second.
We have a motion and a second. Are there any comments from members of the public? If not, roll call vote.
Supervisor Rogers?
Yes.
Supervisor Frazier?
Yes.
Supervisor Gonzalez?
Yes.
Supervisor Wheeler?
Yes.
Chairman Poitras?
Yes.
Vote passes 5-0.
Thank you. And the second item we added onto the agenda is the loss prevention of jobs and revenue from canceled corporate meetings.
Yes,
It's a call letter,
yeah,
a travel letter supporting opening up. So
it's a letter that Cal Travel is requesting on behalf of its association to gather as many signatures as possible to encourage the governor and the CDPH provide guidelines for business meeting events and conventions so that those folks who've been involved in those areas and who employ a lot of people, including a lot of people in Madera County, can begin to plan and to attract those meetings back into California. Without the guidance, it kind of leaves your folks kind of dangling at the end of a string. Just administratively, what will happen here is if you approve participation in this, there is an electronic way we will forward that to the representative group that represents Cal Travel in Sacramento so that they can aggregate the signature of the chairman along with the signatures of the other supporting municipalities and counties.
Okay, very good. Any comments from my
Move to
colleagues?
approve.
Second.
Okay, we have a motion and a second. I believe, first of all, we'll ask for if there's any comments from the public. None. Supervisor Rogers.
Yeah, I just wanted to say that ultimately, while I support the letter, I feel that the evidence is overwhelming from even from a Stanford study that shutting down the economy and society was not necessary or effective. And that they did that study of multiple countries and multiple states involved in the shutdown. I think you look at Florida versus California and the way they've handled the circumstances there. There's been literally no difference in the COVID situation, and yet one was open while one was closed. So what was the benefit? And that's my thought. So anyway, while I support the letter, I support opening up. Forget this stuff.
Very good. So would you like to amend the letter? No, I'm teasing. No. Okay, so roll call vote.
Supervisor Frazier,
Florida, yes.
Supervisor Wheeler,
Yes.
Supervisor Gonzalez,
Yes.
Supervisor Rogers.
Yes.
Chairman Poitras.
Yes.
Vote passes 5-0.
Very good. Thank you. Moving on to supervisor and staff reports. Let's start with Supervisor Wheeler.
Thank you very much. Nothing exciting except for Sunday. Just by happen chance, I went up to get some diesel fuel in town, and there was a car that a couple ladies in. I knew they had on the side of their car Pirates for Hope, and it's a group up here that put together a soup for friends every Sunday from 12 to 2 in front of the Oakhurst Library. And they serve lunch to anybody that wants to come there, and it's usually soup. And I had some, and it was absolutely delicious. And they do this every Sunday from 12 to 2. And I just want to give them a big shout out for doing it. I took pictures and put it on Facebook. Even I hadn't even heard of it, but to that day, and I was really impressed. So I just wanted to thank them and let everybody know what's going on. So it's in front of our Oakhurst Library too. So.
Okay, very good. Thank you, Supervisor Gonzalez.
Just that on Sunday, I was able to spend some time with Senator Caballero, and we met with a few of the businesses in downtown that have been impacted by the pandemic. And I believe that today is the opening of the new round of the funding grants, and we notified those businesses that our office was happy to help in in submitting their applications. So that was part of the big concern for some of these businesses downtown, that some of these applications are a little bit tedious, and so we're happy to offer our assistance. That's all.
Very good.
Great.
Thank you. Supervisor Frazier.
Yes, tomorrow I have my coffee and conversation, 8:30 to 10 o'clock. Anyone who wants to join, jump on. Also, on Sunday, I met with Senator Caballero at the Senate District 12's Small Business of the Year, Riley's Brewing. So got to spend some time with Dan Riley, which is always good on a Sunday. No brewing though.
Very good. Thank you. Supervisor Rogers.
Yes, had my RCRC meeting virtually, 6.5 hours on Wednesday, and I guess we're catching up, hopefully. New CEO and new vice president, a lot of new circumstances there, so hope everything will go well. And then I will have RHA, which is a regional health authority, on Thursday. Thank you.
Okay, very good. Last week, we concluded our Valley Voice presentation with 3 legislators, and something that I heard in both meetings was the recommendation that we are more active in our lobbying efforts in Sacramento. We are up against the metropolitan areas in Southern California, Northern California, and with once a year our Valley Voice showing up in Sacramento, again, they were, I think, maybe not so gently telling us it's not good enough because we've got a lot of competition for funding. So we're going to be looking at that, the policy council to rev our efforts, make them more robust. It could cost some money, but I think it's costing us a lot of money to not be represented. Also, at our CalCog meeting, it was what I really like about CalCog is that it does have a lot of rural representation, and I believe the organization itself is very, very close to CalSTA, and in terms of wanting to adopt a lot of these issues or a lot of these measures that are not going to help us in the rural areas. And the good news is I have a lot of help in terms of communicating who we are, what we are, and we'll continue to pound that message that we need to complete Highway 99 that was promised. It was part of the business plan back in 2006.
Rob,
CEO Varney.
real quick.
Yes.
I'm sorry. I got a notice on my calendar that we're having a meeting next next Tuesday, March the 23rd, but it's not on the calendar on our agenda. Is that, are we having that? Or?
Well, is it for CalCog or?
Nope.
No, for our board here.
Oh, the board here. Okay. No.
Chairman, that was going to be part of my report, actually. I'm glad that's mentioned. There is a special meeting that's being arranged for the Board of Supervisors, and it will begin at noon. And so we'll be putting out an agenda. The primary purpose is one focused area, one workshop, and it'll just be one closed session item. Next Tuesday.
I just seen it on my calendar and I hadn't heard anything. That's the reason I asked. Thank you, Regina.
Okay.
I will.
Surprise, surprise, right?
I'll be unable to attend that. I have a pre-scheduled surgery, so
we're gonna have to cancel it. I'm sorry.
Just letting you know ahead of time.
Let's just zoom in from the OR.
Yeah, like that
Get
doctor.
some true serum in David.
No, don't do that. No. Like that doctor who was in court, he was on Zoom, and and the guy with the cat, we can put a cat face on you or something. So that would be.
Well, hopefully I'll have a better experience than last time.
So, so anyway, thanks, Supervisor, for bringing that up. I was unaware of that. And Jay, was that your stomach or?
No, I think that was something from the great elevation of District 5. So as you can expect, we're keeping a close eye on when the instructions come out on the Department of Treasury website as it relates to what your DCAO over finance has affectionately named Biden bucks. So we'll see how they're going to distribute that. The most recent information we received, and again, this is all semi-speculation until it's actually posted, is that we will not be receiving all that money in May. You'll receive half in May of this year and half next year. So from your CAO's perspective, that makes way more sense than giving us one giant lump sum of one-time money. So as we get farther down the road, we'll be able to bring more information back to the board, and that concludes my report. Thank you.
Boy, that's so great. Thank you. And Council Garza.
No further report. Thank you, Chairman.
Clerk of the board?
Nothing to report. Thank you.
Okay, very good. And with that, we shall adjourn. Everybody have a great rest of the day.
Thank you, everybody.
I will probably